Okay, welcome everyone. For our latest installment of Shibani Live, we're going to continue sort of on this health kick that we've been talking about recently, and for lots of good reasons. I'm joined with Dr. Nancy Lonsdorf. She's a Johns Hopkins trained physician. She's an author, a speaker. She talks about all sorts of things, including Ayurveda, integrative medicine, high performance brain and mind function. And she was also named one of the nation's most prominent Ayurvedic doctors by the Chicago Tribune. So she's certainly somebody who knows a lot about Ayurveda, and we're going to talk to her about what that is and how that can be folded into the current medical environment and the benefits, particularly as we're changing seasons, but also as we're about to change our lifestyles with different sheltering in place sanctions getting lifted, what we can do to boost our immunity, and that and so much more. So, Dr. Nancy, thank you for being here today.
It's great to be here. Thanks for having me.
Before we get started off, where can we find you? Where can we learn a little bit more about you, so that as we go along, we can learn about what you're doing?
My website is Dr. Nancy Health, drnancyhealth.com. And you can go there. There are quizzes on the site, which I would encourage anyone to take. I think they're both relevant today. One is for stress. And when you take the quiz, then you get a tip a day for a week in order to integrate some new things into your lifestyle. And there will be things that are according to your stress type. This is an Ayurvedic concept that different people react to stress differently. So there are different herbs, different diet, different behaviors that will give you the most benefit.
So let's talk a little bit about your path towards Ayurveda. You and I have been working together for a few years, and that's how we know each other, as you're helping me incorporate more principles into my Ayurvedic, into my everyday lifestyle. But tell us a little bit about your background and what draws you to Ayurveda.
Well, my background is traditional Western medicine. I went to Johns Hopkins Medical School, and I trained in Stanford in psychiatry. And I was interested in the mind-body connection even from an early age, but I was pretty straight and narrow in terms of medical until I learned about Ayurveda. And it was a perfect complement to my interest in meditation, and comes from actually the same tradition as yoga from India, the Vedic tradition. And so I started to learn more about it when I was in my residency training at Stanford. And I just found that this was a way that I could actually help my patients get healthier and equip me with so many just very practical, simple things people could do in their daily life that could take care of skin rashes or digestive problems or sleep problems or anxiety or whatever the problem was. The Ayurvedic dimension of how it looks at an individual, and everybody is different by their constitution, but also what kind of disturbance in their natural balance might be happening, and then what you do to correct it. So I got started really early in integrating something different into my practice. That was back in the 80s.
And so tell us a little bit about the marriage of Western medicine and Eastern medicine, for lack of a better word, how that plays out in your practice and what the role is. I think we're seeing this happen as a trend across the medical industry. Tell us how you're personally doing it, though.
Well, I've been integrating it alongside Western medicine, and I think my patients appreciate that. And of course, it gives me a lot of confidence because I know I'm not going to miss something important because I didn't, do the Western medical workup, or that I didn't ensure that the patient had that done. So I take that sort of as the baseline start. Where other doctors leave off, that's where I begin. So I make sure there's nothing, really serious. There's no mass where they're having digestive problems, or there's no, anything serious that needs Western medicine. Or if there is, that it's under control. And now we're going to add on to that. And we're going to look at what we can do to start the healing process from within. Because unfortunately, Western medicine is not oriented towards that. It's oriented towards kind of suppressing symptoms and controlling a disease process. Whereas Ayurveda and, our natural instincts are, we want our body to heal. We want to be healthy. So Ayurveda gives us so many tools to do that, and much more detailed than we have, I would say, from a lot of systems that help people, but they're missing the dimension Ayurveda has of individuality.
And we've heard this is a big component that, is missing from a lot of the medical education training from medical school, from just the concept of Western medicine, is how important diet is and lifestyle in terms of creating healing and healing opportunities. So it sounds like Ayurveda is a nice approach to marriage into Western medicine.
Absolutely. It's very complementary. There's really no conflict. And I think that it's the missing link. When we talk about vulnerability today to, say, the virus, the COVID-19, and who is getting the most serious outcomes from that, and who is it not affecting so strongly. And we don't really have hard science answers yet. That'll take a lot of detailed research, but it does appear that those who have underlying conditions, whose bodies, we could say from an Ayurvedic point of view, their body's already pretty out of balance and maybe in a pro-inflammatory state. Mm-hmm. So they are more prone to have their immune system go out of balance to the extreme when they get an infection and create all the serious inflammatory runaway inflammation that can't, ends up not being able to be controlled with this. So, I think that making your body basically as healthy as possible is the best insurance that we have, in addition to isolation and keeping your hands clean and wearing masks. I believe in all those things. We have to do that. We don't want to put ourselves right there in the minefield, without any protection. Yeah. But we also want to make sure that our body, if we do run across that virus or any other thing that challenges our immunity, that our body responds in the most balanced way. Mounts its attack, gets rid of the virus, and doesn't destroy the body in the meantime.
So let's talk about some of the tenets of Ayurveda. Is it a diet? Is it a lifestyle? Is it hard to do? Let's give our viewers a primer in terms of what does that mean? Because people talk about it, but people don't really understand it.
Yes, Ayurveda, maybe a generation ago, for example, in India, was more of a lifestyle. So people didn't think about it as being anything. They, just like we would get up in the morning and have the breakfast of champions and, or frosted flakes, and then we rush off to school, and maybe we stay up watching the Johnny Carson show late at night or something. I'm telling my age here. And just kind of, that was our lifestyle. But Ayurveda was part of a lifestyle in India where people just would get up with the sun and would go outside and walk in the grass and maybe do some yoga right out there in the fresh air. And then they would come in and they would have certain types of foods that were just as natural to them as our diet is to us in the West. So it's really meant to be a lifestyle that honors the season changes, honors our body and the understanding. Really, it's based on a very deep scientific understanding of how the body interacts with the environment. The epigenetics was appreciated by Ayurveda thousands of years ago. This concept that, our genes are turned on and off by different influences from our food and our lifestyle, our daily routine. It knew about chronobiology. It has a whole prescription for, when we get up, when we go to bed, ideally, so that we are kind of riding the waves of nature in our body rather than kind of going against the current.
Do you think that we would be able to, in this modern cell phone centric, fast-paced environment, can we reasonably incorporate Ayurvedic principles into our American lifestyle? And if so, how? What are some of the things that we can do to be more in tune with nature, to be in more tune with our bodies?
Well, I sent out a blog a week ago about the morning walk and how Ayurveda says that of all the recommendations, the one thing that if somebody does, it will give them the most benefit, and that's taking a walk in the morning sun outside. So walking in the morning sun is said to be good for anybody of any age. any condition. And it turns out that I've done a little research on that, and it turns out that having exposure to light in the morning, outdoor light for about 20 minutes minimum, is associated with more normal body mass index, meaning not overweight. And this was discovered by Northwestern University scientists about 5-7 years ago by analyzing tons of data and say, why are some people, young people even, keeping their weight normal, and some people are having trouble, and they controlled for diet and caloric intake and even sleep, and they found that it was morning light exposure. And then research also shows that exercise in the morning is the best time for creating a drop in blood pressure during the night, meaning for our cardiovascular health. Exercising in the morning will give us longer term, more balance in our cardiovascular system.
Oh, that's so interesting. Yeah, these are things that we already do. We're just, if we tweak them a little bit, they become better for our bodies and Ayurvedic as a result.
There you go. Yeah, the tweaks for different people. Some people, like I had a newscaster once, a radio show host once, who had a condition of her bowel that was diagnosed as irritable bowel syndrome, and she would find after lunch every day she'd have to run to the bathroom. It was a lot of discomfort. And when I evaluated her, I said, well, your digestion is out of balance in this way that Ayurveda defines, and that means you should not be having a big salad for lunch, but you should have a big bowl of raw vegetables. I said, you need cooked vegetables and warm foods and plenty of good healthy oils in your diet, and use a few of these spices. And she wrote me a week later and she said, I have not had any of those symptoms ever since I changed my diet. Mm-hmm. And even a year or two later, when I saw her in follow-up, she just said that was it. It was just the wrong food for my type.
That's so interesting. Yeah, because our current diet is very raw vegetable centric. It's on the go, full of all sorts of things. And you get different pieces of advice from different practitioners. So let's take it back to the basics a little bit. From my understanding, Ayurveda starts with dosha types. And based on our doshas, right, we have a majority constitution, and then we're kind of all three doshas, but one is more predominant. Explain to us the dosha system, for lack of a better word, and how it informs our approach.
Okay. Well, in Western medicine, we look at the body in terms of like a collection of organs, and for every organ, there's a different specialist, like an organ system. Like for our nervous system, we've got the neurologist. For the heart, we've got the cardiologist. For the joints, we've got the rheumatologist. So we have a way that we're looking at the body that's very isolated. And what Ayurveda does is it says, what's common to all the systems, all the cells, all the tissues, all the organs? Let's look at what's common. And it identifies three things that every part of the body needs to be alive. And basically, we could, if we had more time, we could do a guessing game. But basically, we need movement. Think of the heart. The heart's got to be beating. And in order for the heart to beat, we also need to produce energy. We need energy production. So that's metabolism, movement, metabolism. And then, of course, we need the body. We need some muscles and tissues and water and all the physical matter, or we wouldn't be here. So we need structure, metabolism, and movement. And when we have those three things, we can maintain life. So Ayurveda says that every person, obviously, in every part of their body expresses these, but depending on the person and their genetics, they will express them differently. So, for example, one of the most clear genetic studies for the Ayurvedic body type so far has been the metabolic type. And it says there's a certain genetic pattern that gives people very strong metabolism and digestion. And also with that usually goes a mind that's kind of more fiery, like they have a lot of mental energy, and maybe they can lose their temper quickly, but they usually gain it back fast. Get back to balance. They also tend to have a lot of ambition. So that would be, we say, the Pitta type or the metabolic type. And then there are the people like my patient who couldn't have raw vegetables for lunch, and she's what we call the movement principle. And those people are vivacious, but their system is very sensitive. And I think we all know people, either ourselves or someone we know, that we kind of think, why do they have to be so picky about everything they eat? Or, that's their system's very sensitive, and it will change and respond to just, eating some raw carrots. Maybe will throw them off balance. So everybody's different. That's the movement type. And then the structural type is that kind of proverbial maternal or earthy person who's stable and steady, and they love routine, and maybe we feel that they get to be a little bit of a stick in the mud, but they're also the person we go to because they're the person who you can always count on. They'll always keep their word, and they're like a rock in terms of being stable and supportive and helpful. So we have, it's the variety that makes the dish so delicious, and that's kind of what we have with body types and all the different body natures. But with them come specific diet recommendations, like people prone to heartburn. That's really common in our today's society. Heartburn, they should not be eating very acidic food. Even Western medicine might tell them that if their doctor's a little diet oriented. Yeah. Might say, well, hot spices and tomatoes and acids and alcohol are not good for your stomach, and caffeine. So actually some of the Ayurvedic diet principles are there in Western medicine, but so much has not been yet formalized.
How can we learn more about the dosha systems and figure out kind of what constitution we are? Any resources that you would recommend?
Well, there are tons of things now on Ayurveda online, and I would invite people also to come to my website. And if you want to learn more about your digestive type, you can take a quiz for that. And then you'll get a tip once a week that you can integrate. You have a whole week to integrate a new tip. And I also have the stress type quiz. Sometimes those are different. Sometimes one person's mind might be more the strong, focused type, but their body might be a little the sensitive type. So their digestion may be one way, and their stress level may be a different. So I have the two different ones, and I've written a couple books, especially for women, on A Woman's Best Medicine and The Ageless Woman, which is more geared for women going through menopause and how to stay healthy afterwards. So, and Ayurveda just become so popular. 35 years ago, I was in this, and it was basically not known by anyone. But I think almost anyone who does yoga knows the term Ayurveda, and there are lots of resources today.
And a lot of doctors are also creating these hybrid approaches. There's Ayurveda, there's integrative medicine, there's functional medicine, there's probably other terms that I haven't even heard of. Can you explain the difference? I mean, I think as a quote-unquote consumer, there is a lot of confusion about what all those terms mean, and maybe what the skill set is behind the people as well. Is I think you assume that a functional medicine doctor is an MD, and that's not necessarily the case. So maybe you can explain and give us a little primer in terms of that.
Well, if a doctor has a medical doc as an MD or a DO, a doctor osteopathy, they basically have the same training. Osteopaths are like MDs, but plus they know spinal manipulation and they know physical treatments for the body. But any of those, I would say integrative medicine, when I see somebody use the term medicine, I'd like to see that they have a medical degree and a license to practice medicine. So I'm going to assume, but you shouldn't assume. You should make sure that the person's licensed. I think that, the main thing is that if you go to a doctor who's licensed and to practice medicine, and they have skills in something besides Western medicine, maybe it's traditional Chinese medicine or Ayurveda, or maybe it's homeopathy or a combination of a lot of those, or functional medicine, then they can call themselves integrated because they're integrating the Western or the conventional medicine with something else. So that's a kind of a general umbrella term, integrative.
Got it.
And functional medicine is a particular set of training and skills, which some of which I use in my practice, but I've never gone through their full training program because I guess I've seen too many patients who've done that, and I utilize a lot of the things that I find useful about functional medicine, but oftentimes people end up coming to me when that hasn't been fully helpful to them, just because Ayurveda has a whole nother dimension and nothing else can really substitute for it. So, I mean, ultimately, functional medicine should teach Ayurveda in its fullest and include that. That's, in my opinion, because otherwise it tends to be limited in certain ways. You know, they definitely look deeper into your nutrition. Mm-hmm. They look at the idea is how is the body functioning, and they evaluate it primarily through looking at detailed laboratory examinations of your blood, of the stool, of the urine, look at how the metabolism's working, where do you need more nutrients, where are there toxic heavy metals or other things, how can we purify the body, and they do take a long history and they try to understand the person in their wholeness. But with Ayurveda, the main thing that I find so helpful, besides just the whole framework of Ayurveda, is also taking the pulse here and feeling the vibrations, the flow through the body gives a lot of information. You might have heard of, like, the Dalai Lama has his own physician who is basically Ayurvedic and takes his pulse. Mm. It's a very long established tradition, and it gives a lot of information. Even I work with a lot of people over the phone or video conferencing, and I can instruct people in less than 5 minutes to give me information about their pulse when they've never put their fingers on their wrist before. So it's something that's even applicable in today's telemedicine environment.
Yeah, that's so interesting. And you are not reading the rate of the heartbeat, you're reading something else. Tell us about the pulse reading, because when I've worked with you, that's the first place we always start is you check my pulse, but you're not checking it in the way that you would do it when you go for a more traditional doctor's appointment.
Yes. Well, rate actually is one of the factors, but it's one of maybe 3 or 4 dozen factors we're looking at. So, yes, if the pulse is very fast, that gives us information. But so many qualities of the pulse. There are actually 4 levels of pressure. One, like light, and then a little deeper, and then the deepest. So there's 4 levels that we actually feel the pulse under the fingers, and with different levels of pressure you get different information, because if you can imagine the artery and the wall, one wall, the artery, and down here, it's you're looking at a cross section and the blood's flowing through the middle, there's a pulse wave that's going through, and if you're feeling very lightly, you're going to feel certain subtler vibrations, and you press deeper, you're going to feel different things that reflect something different in the body. So, if it's very light and maybe it feels a little bit changeable, like it maybe beats steady, but the full feeling under the fingers is shifting. That's the more person who's more sensitive, that we call a vata, or the movement dominated person. And then a person who is metabolic dominated, their pulse will feel almost like it's jumping out of their wrist. It's like coming up and hitting your hand is like anything but subtle. It's warm and it's full and it's dynamic and it's strong. And those people are those like that in life. They're the CEOs and the just like endless energy and drive and ambition, and they get up and they go. Yeah. So, they have a genetics that supports that. And then a person who may be that structure dominated person, that kapha steady rock type person, their pulse will have a very regular, very steady, very smooth, kind of very settled and calming. It'll feel calming just to take their pulse. That's kind of what their nature is. They're feeling that way. That's how they are, and their pulse reflects it. Mm-hmm. And there are many variations. We can feel the digestion, what's going on. Is it balanced, or is this person... sometimes I take someone's pulse and I might just spontaneously think, and then I'll ask them, do you sit at your desk for lunch, or do are you in your computer and eating at the same time? Because I can feel the disturbance in the digestion, that they're just not settled when they're eating, and then their digestive process is all kind of like this. So no wonder why they get gas or bloating at 4 or 5 in the afternoon or at night. So there's just a lot of clues. We can also see, if somebody has maybe some strong emotional pressure, that will show up as a certain type of impulse. Say, well, have you been under a lot of emotional stress lately, or even the past stress? Like, if it's not resolved, it can show up that there's some like heartache or some kind of emotions stored there.
That's so interesting that you can read all of that from, just gauging a pulse. Let's move to some active practices that any of us could take to become more in sync with our bodies, be in sync with nature. You talked about the morning walk. Give us some other suggestions that we could use to boost our health, boost our immunity.
Well, one of the things that'll sound like your mother, eat regular meals 3 times a day, or at least eat regular meals. And ideally, you want to have your lunch as the main meal. This is an Ayurvedic wisdom that the digestion is strongest in the middle of the day. And that's when our body can best assimilate and use the food and use it to build the body and give us energy. So it's a really good time of the day to have your main meal. And I like to tell people that if you're looking at a plate of food, have at least half of it cooked vegetables.
Vegetables, yeah.
They don't have to be cooked to death, but just cooked. And with some good oil, healthy oils. Either you add it afterwards, you steam it, and you can add olive oil, or you can saute it in some healthy oil. And spices are very helpful, depending on what you like. I usually at least have fresh ginger, saute my vegetables with chopped fresh ginger. Sometimes I'll do more Indian, like coriander or cumin, fennel. There are all sorts of things that you can do. You can make them more Italian spices. But some spices actually help digestion, and they're actually very good for immunity. In fact, basil and the Italian spices are very strengthening for the immune response. But they also are anti-inflammatory at the same time. So that's what you want, something that will stimulate the immune system, but keep it balanced.
So not raw salads is what you
not raw salads for most people most of the time. Especially if a person's prone to gas, bloating, constipation, or irritable bowel, you really want to stick to warm cooked foods, and then have your whatever you eat. If you're vegetarian, some good protein source, or if you're not vegetarian, if you're having meat or something like that, lunch is the best time to do that. And then in the evening, I recommend everybody have a vegetarian evening meal, ideally kind of early, like by 7 o'clock at the latest. And then Ayurveda says have 3 hours from the end of dinner, like 7, till you go to bed. And ideally you go to bed by about 10, because there's another cycle that actually the body goes into of metabolic house cleaning. And now there's a term for it in Western medicine called autophagy, where the cells actually eat up and burn off the waste.
The intermittent fasting, right?
Yeah, this is intermittent fasting. And I was telling people to do that for, since 1986 when I started with this. And it's only the last 10 years that it's like everybody now kind of understands it and it's promoted. But Ayurveda, I wasn't just 20 years ahead of the time. Ayurveda was 5,000 years ahead at the time. So it really appreciated all these cycles just through the intuitive, deep intuition of these great physicians. And, in Ayurveda, just Veda, the whole tradition of meditation and yoga, this was a very deeply cognized, we could say, science of its own, of how to move the body in different ways to enhance flow and to heal and to keep the system in prime operating condition, to promote growth of one's spiritual nature. This was that was the science of that day and age.
Yeah, and it's coming back into vogue, for lack of a better word, and people are getting more connected to it in our culture as well, which seems very appropriate and very needed right now. Let's talk a little bit about detox before we wrap things up. I know that that's something that you and I have also worked with together on detoxing and the importance of that with the seasons and maybe a few times a
Mm-hmm.
year. Let's talk about what you recommend for right now. It's almost the end of May. The seasons are definitely changing. You can notice that even by the sun rising and sun setting. What should we be doing right now?
Well, one of the things that Ayurveda has said all these years is that our body changes with the seasons. And actually, when I began to practice Ayurveda, some of these concepts were a little hard for my Western mind to grasp or to accept, especially as an independent kind of, Westerner, like I'll go to bed when I want to go to bed, or I'll eat when I want to eat, So it's like, what do you mean? The season changes, I should eat different foods. That didn't make any sense at all. But now, actually, there's beautiful research that shows how as much as 25% of our genes, about 5,000 genes have been identified that actually dramatically shift their level of activity with the seasons, particularly around, this change from winter to spring, and then in the fall from summer to winter. So these genes they're genes that are very high in their activity in the winter. At around the end of March, March they start really dropping, and then around the equinox, all these genes that were like they were down here low in their activity, and the genes that were high, they start to cross.
Yeah.
And so right around that time of the change of season, there's a tremendous flux because, the curve, we know about curves now, flattening the curve. Well, that's when this curve is steepest of the active genes damping down and the inactive genes ramping up. So we have all this change going on in the body, and Ayurveda said that this is a time of a lot of change in the body. So we want to make it easy for our body to go through that transition, and also especially from winter to spring, it says it's like the melting snow on a mountain. The impurities in the body that have been kind of stuck in there because the body was trying to stay warm and it was cold outside and constricts, all these channels start to open and toxins and impurities want to flow out. So at this time of the season change, drinking warm or hot water is, of course, the universal detoxer. But drinking it warm to help the channels open and flow, because we know that cold things cause channels to constrict, cause us to tighten up. So warm things help to increase flow. They also help elimination from the bowels. They help peristalsis. Warm water, hot water stimulates the elimination. So we want to be drinking hot water during this time and avoiding things that are very heavy and cloggy, like cheese and meat as much as possible. This is a good time to do vegetarian or vegan for a few weeks. Mm-hmm. Drink a lot of hot water. You can, find ways to get good protein so you can support your chemical detox, your enzymes and all. They need good protein to work, so we want to support that too.
And it sounds like it's not so stringent, like rigid. It really is about being in tune with your body. I think that's one of the things that people hesitate about switching to, these different ideologies. Ayurveda, I found, is very forgiving and very fluid and suggestive, but not demanding. Would you agree with that? And what more can you say?
Well, I think anybody can just look at you, Shabani, and say, whatever you're doing, they're going to want to do. So, because you look very radiant and very healthy. And this is really the aim of Ayurveda. I think a lot of times people can overdo these detox things. Yeah. They can stress their body out. They can lose too much weight. They can get undernourished. They can, cause a lot of elimination and kind of weaken their system. So Ayurveda is always keeping in mind the whole body and maintaining balance at the same time as promoting detox. So everything is gentle, but if you're following basically the principles of Ayurveda in your daily life, which again are, like you say, there's a flow and it's not so demanding. We have to eat anyway. Why not organize that we eat more of our food earlier in the day? So, and drink more hot water instead of ice cold water, especially with our meals. So these principles of promoting good digestion, just basically, how can we live in a way that helps the body do what it wants to do, which is just digest, metabolize, keep us strong, keep us healthy, keep us balanced. Sleep is, everything, just being in that flow of what can support the body.
Thank you, Dr. Nancy Lohnstorff. This has been a great conversation. We have some great tips I hope that people picked up on. And it's good to see you as always. And I remind everyone where we can find you if they want to learn more about Ayurveda and the principles that you support.
Yeah, just go to drnancyhealth.com.
Okay. Dr. Nancy Lohnstorff, thank you again. It's great to see you. Thank you for your time today.
Bye, everyone. Have a good day.
Thank you. You too.